In nursing, greatness emerges not from ease, but from the hours, tears, and courage no one else sees. Good day. We are the researchers from BSN 3B Group 1B. I am Mariel Canonigo, and together with me are Sandara Bermejo, Mary Caranguit, Alfred Carisma, and Edwin Cornel, under the guidance of Doc Sheilla Trajera and Doc Rica Flores. And our research title is Journey to Completion Lived Experiences of Top Performing Level 4 Nursing Students in Clinical Learning. As for the purpose of this study aimed to explore the lived experiences of top performing Level 4 nursing students in clinical learning. For the methodology, for the research design, the researchers use a qualitative and phenomenological approach and an in depth structured interview to gather the data from the participants.
As for the participants, 8 top performing level 4 La Salle nursing students aged 21 and above enrolled in the academic year 2025 to 2026, with completed levels 1 to 3 in the same institution. Clinical exposure from level 2 to 4, completed simulations and clinical duties, hourly grade of 95% and above, and experience of clinical challenges participated in the study. A purposive sampling technique was used to choose the study's participants based on criteria.
Next, we will discuss the instrument. Part 1 was the socio-demographic profile, and Part 2 comprised the overarching questions. Tell me about your overall experiences as a top-performing Level 4 nursing student in clinical learning. Part 3 followed, wherein the probing questions were asked. As we move towards our results and discussion, allow us to walk you through each part of the simulacrum to deepen your understanding of the insights revealed in this study. We will start with our first theme, balancing time amid technical and clinical demands, under which is our first subtheme, cultivating discipline through purposeful actions. This subtheme is summarized by Dimitri, who stated, I make a conscious effort to stay focused and present. I remind myself that every action has consequences, especially in patient care. Second subtheme, navigating motivation beneath pressure's weight. As stated by Dorothea, I am driven with a thought on my future patients, the lives that will one day depend on my knowledge, competence, and compassion. The third subtheme titled Carrying the Burden of Clinical and Emotional Demand. As stated by Erickson, I often felt like 12 to 24 hours in a day is simply not enough.
For our second sub-theme, it is the nurturing growth through guiding hands and learning spaces. Under that is our first sub-theme. Drawing courage from mentors' guidance and support, as stated by Virginia, they corrected me, guided me, and sometimes reassured me when I doubted myself. Our second sub-theme, building strength in shared peer support and teamwork, as stated by Virginia, we all shared the same fears and pressure during duty, so we really helped each other. For our third sub-theme, creating safer spaces for learning and support, as stated by Dorothea, I hope that the clinical environment will continue to nurture students not just academically or in terms of grades, but we also foster our emotional well-being during our duty.
The third theme is Rising Through Moments of Doubt Toward Clinical Confidence, with our first sub-theme is entitled Growing Skills Through Real Moments of Care. As stated by Ernest, through these clinical experiences, I learned to anticipate possible complications and think ahead rather than simply following instructions. Second sub-theme is Finding Confidence in Trust, Feedback, and Support. As stated by Galileo, in a new environment, your confidence goes back to zero, but your peers, classmates, teachers, and staff are there to help you. And the last sub-theme is Cultivating Inner Qualities That Shape Competence and Care, as stated by Virginia. Communicating with families pushed me to step out of my comfort zone, to stay calm under pressure, prioritize care efficiently, and make sound nursing judgments.
The fourth theme is Embracing Compassion and Patient-Centered Care. The first sub-theme is Nurturing Empathy at the Heart of Patient Care, as stated by Madeline. It is about the compassion and presence we offer to people who need our care. Second sub-theme is Building Trust Through Healing Words and Communication, as stated by Jean. A simple gesture such as sitting beside them, maintaining eye contact, and offering a reassuring nod can already make a difference. The last sub-theme is Showing Compassion and Responsibility in Difficult Moments. As stated by Jean, but then I reminded myself that patient safety must always come first. The life and well-being of the patient are more important than my own hesitation or embarrassment.
In conclusion, This study revealed that the lived experiences of top performing level 4 nursing students were shaped by the challenges of balancing academic and clinical demands, the guidance and support of mentors and peers, the confidence developed through clinical exposure, and the compassion nurtured in patient care. These themes strengthen the core concept of the study, journey to completion. The findings showed that clinical learning is not only a place for skill development, but also a foundation for building competence, confidence, and compassion, and preparation for professional nursing practice. Through every challenge, sacrifice, and patient encounter, their journey became a process of growth that transformed them into skilled and compassionate future nurses.
Let us now move on to recommendations. First, the College of Nursing academic administrators may strengthen academic support systems through better workload balance, clinical scheduling, and student wellness programs. Second, clinical instructors may continue providing mentorship, guidance, constructive feedback, and a supportive clinical environment that promotes competence, confidence, and professional growth among nursing students.
And lastly, for future researchers, further studies may explore intervention based approaches focusing on mentorship, debriefing, mental health, resilience, and clinical learning experiences in different clinical settings.
You may scan the QR code for our references. Thank you so much for listening. Have a great day ahead.